So I check the patient's chart, I do hand hygiene, provide privacy, introduce myself to the patient. Hi Brian, I'm Frank. I'm going to be your student nurse today. Could you tell me your name and birthday, please?
My name is Brian LeBeau. I was born January 14th, 2000.
Excellent, Brian. And then I explain the procedure. Brian, we're going to do an assessment today. That's what you had come here for, correct? So we're just going to check from your head to your skin, mouth, nose, ears, lips, everything. We're just going to do a full assessment on you, okay?
Okay.
All right. Well, let's start off with your skin. So have you noticed anything with your skin that perhaps would present a problem to you? Maybe acne, or perhaps you had athlete's foot or something like that. Do you have any scars or burns or anything?
No.
Nothing? No? Any bruises, scrapes, abrasions, nothing like that?
No.
Okay. Mind if I take a look?
Yeah.
All right. So I see your skin looks good. Acne is pretty well under control. Good. How do you treat your acne?
I just shower and wipe it off when I get home.
Excellent. I don't see any lumps, bumps, or bruises. I do see reddish pink undertones, which is good. All right. Brian, I'm going to do a capillary refill test on. I'm just going to press. I want to see if the blood returns in 3 seconds. While I'm doing that, why don't you tell me if you've been on any vacations and what you do for hobbies?
Well, I went on a vacation up north to Wells Lake. It's pretty fun.
How'd that go?
Really good. We went kayaking and swimming and stuff like that.
Awesome. Sounds like a good time. What do you do for hobbies?
Well, I play guitar and I play basketball and I make YouTube videos.
What do you do on YouTube?
Well, I've got my own channel and
Really?
I just record games and talk, just do things people want.
Yeah.
Want to see,
What's it called?
It's called Above Average Gaming.
Cool. All right. So I was looking to see you had some calluses here, and you said you play a guitar, so that probably has something to do with it.
Yeah.
When you're on vacation, did you get any spider bites, mosquito bites, or anything like that?
No.
Okay, you did a lot of swimming.
Yeah.
Did you wear sunscreen?
Yes.
Okay, because I was wondering. I saw you're kind of fair skin. I was wondering if you burn easily.
Yeah.
You do? Okay. What kind of sunscreen do you use? Like a high SPF, or
Yeah.
you apply it often?
Yeah.
That's good, Brian. Okay. I'm gonna take a look at your hair. I can see that you have coarse hair. Is that normal for you?
Yeah.
Oh, okay. Have you noticed any excessive hair growth or excessive hair loss anywhere on your body?
No.
No. Have you ever had a history of lice?
No.
What about anybody in your family?
No.
As far as skin goes, anybody in your family had any problems?
No. Well, my dad has eczema.
He does?
Yeah.
Okay. Have you ever had a problem with eczema?
No.
What about in the wintertime?
No.
Nothing? Your hands don't get chapped and stuff like that?
No.
Okay. Well, that's good, Brian. We talked about what you did on vacation. I think that's good. Your head looks round. I didn't see anything abnormal, no dips or anything like that. Do you feel any soreness when I press on your head anywhere?
No.
No? Okay. I'm going to check your Tmj joint right here. Go ahead and just open your mouth and, okay. That's cranial nerve number 5 and that is intact. Do you ever get popping or clicking sounds, anything like that when you yawn and stuff like that?
No.
No? Okay. I'm going to check your temporal artery. And I can feel a pulse there. Go ahead and feel that. That's kind of neat. Did you ever try that before? Ever noticed you had a pulse there?
No, that's
You
pretty
did
cool.
good blood supply to your head. That's good. Excellent. All right. Could you do me a favor? I need you to smile, and then I need you to frown, and then I need you to blow your cheeks up. I know it sounds silly, but I'm checking for cranial nerve number 7 to see if it's intact. All right. Go ahead and smile. Good. Frown. Good. And blow your cheeks up. And hold it. Hold it real tight. Good. Cranial nerve number 7 is intact. Excellent. All right. So let's move on. What I'm going to do now is I'm going to check your neck. I'm going to check maybe any soreness in your throat, nothing like that.
No.
What about, can you feel where your Adam's apple is? Go ahead and
Yeah.
feel that. All right. On each side of that, you get any soreness inside there? Any swelling in there? Anything that you can note? No? Okay. I might check that out for you. Okay. Go ahead and swallow. Good. Now this side. Nothing?
No.
Good. Okay. Well, that seems fine. That's good. I'm going to check your lymphatic system. Okay. And I'm going to start with your pre-auricular. I don't feel anything in there. Post-auricular. I don't feel. If you feel any soreness when touching these, let me know. Okay.
Okay.
Occipital. Nothing. Thyroid. Submandible. Okay. This is your submental. Okay. Nothing, no soreness there?
No.
How about superficial cervical?
No.
Okay. And your posterior cervical?
No.
Nothing. Okay, here's your clavicle bone and put Posterior clavicle. Anything in here?
No.
Okay. No soreness?
No.
Excellent. No, I don't feel any lumps. It doesn't feel like there's any swelling going on there. So that's a good thing. So let's keep moving forward. I'm going to look at your lips and your mouth and stuff like that. I want to see, have you had any lesions such as like cold sores or anything like that on your mouth? Well, family history of it? No. Okay. Girlfriend, perhaps? Nothing? Okay. So I'm going to take a look. Appears to be moist. No lesions on it. And your lips are symmetrical, which is good. Could you open up your mouth? Okay. I see your gums. Gums are pink and healthy. Doesn't look like any cavities. Have you had a history of any cavities? It doesn't look like it. Okay. Your mucosal membrane looks healthy. Tongue. I'm going to get a tongue depressor here.
Okay.
Okay. Tongue out. Tongue is moist and healthy. The hard palate's good. Uvula looks fine. Pharyngeal wall's fine. Brian, when did you have your tonsils out?
I'd say 10 years ago or so.
10 years ago. Okay. So would you say you've been healthier since then, or yeah? Were you sick a lot before that? You remember? Yeah.
Yeah.
Okay. Well, that's good that you're better. I'm gonna throw this away. I'll be right back.
Okay.
So I noted, Brian, when you said and I stuck that in there, that your cranial nerves were good there. No problems with that. Let's see, we're going to do an eye test here in a second. Your cranial nerves for that was 9 and 10, by the way. Oh, I have to say for the video.
Yeah.
So I'm going to do an eye test for you, okay? What I want you to do is look all the way across the room. I'm going to bring an object in, and all I want you to do is focus in on it, okay?
Okay.
Very good. All right. Have you had a problem with any? Do you wear glasses, or you have like headaches or anything like that? If you watch TV or play video games too long,
No.
you don't wear glasses,
No.
even if you read.
No.
Okay. Your typical yearly physicals and your eye exams, and you read the charts. They ever commented that maybe you needed to get glasses or anything like that?
No.
Okay, good. So I'm gonna do my 6 cardinal gazes test, and all I want you to do is follow this around without moving your head. Can you
Okay.
do that for me?
Yeah.
Okay. Very good, Ryan. Cranial nerves 2 was when I brought the test in for your perla. 3, 4, and 6 are all intact, but I do need to check this. They are round, they are equal, and I need to see if they're sensitive to light and accommodation. Very good. Both of them are reacting. Same on the other side. Both are reacting, which is good. I see that I'm not trying to blind you here, but your eyelashes curl properly and distributed properly. Could you lift your eyebrows up for me? Close your eyes really tight. Excellent, Brian. Okay. Let's move on to your ears. Have you experienced any problems in hearing loss? How about your family?
No.
Nothing? Do you ever feel like you got to build up a fluid or something like that in your ears so you notice that your ears drain a lot or anything?
No.
No? Okay. Do you use Q-tips when you clean your ears?
Yeah.
You do? Okay. You know not to shove a Q-tip too deep in there. Have you ever heard that before? You ever hear the saying about the elbow?
No.
Okay, don't stick anything smaller than your elbow in your ear is what they say.
Oh.
So I can't be there when you clean your ears, but I do have to inform you of it, okay? I'm not supposed to stick things in your ears. Okay. And I'm just going to check, make sure the placement, your ears and eyes are in the right placement, which is good. Very good. I'm going to take a look on the inside, okay? So you have for me, please. All right, I can see that they're nice and clear and clean in there. I don't see any wax buildup or drainage or anything. Nothing alarming. That looks fine, Brian. Let me see. Let's do a little hearing test. I'm going to have you close your eyes, okay? And I'm going to make some sounds in your ears, and I want you to tell me which ear it is and when the sound starts to go away, okay? So go ahead and close your eyes.
All right here. There.
Gone? Okay.
Left ear. There.
Gone?
Yeah.
Okay. Close your eyes. Tell me if you hear it on one side or the other.
No.
What's that mean? No.
Oh, that means
Equal?
they're equal, yeah.
Okay.
Yeah.
How about now?
Yeah, they're equal.
Equal?
Yeah.
Good, Brian. I think your ears are fine. That's cranial nerve number 8. That seems to be intact. Now we're going to move on to your nose. And we should pretty much conclude with that. By the way, are you on any medications?
Yes.
What are you on?
Vyvanse.
Vyvanse. What's the strength on Vyvanse?
40
Is
milligrams.
that for ADHD?
Yes.
Okay. How's that going for you?
Pretty good.
How long have you been on that?
Since about middle school.
Middle school?
Yeah.
Okay. You getting good grades?
Yes.
Like what?
A's and B's.
I'd say it's doing fine. Okay, good. Does you get any side effects of that? Does it keep you up late at night or anything like that?
No.
No. Okay. Loss of appetite?
No.
Okay. All right. I'm gonna take a look at your nose. Have you any nasal drainage or
No.
stuffy nose, anything like that? Any soreness on your nose?
No.
Okay. I'm gonna feel around. Tell me if you feel any soreness.
Okay.
Anything?
Nope.
Nothing in there? Okay. I'm gonna take a peek inside, all right? Head up. Okay. Pink. It's clear in there. No drainage of any kind. No, it doesn't look like any redness or anything. I'm gonna look on each side. Light distribution's fine. I don't see a pinhole or anything, so that's good. Your septum's straight. It's not deviated or anything. That's good. I'm gonna do a smell test. I'm gonna bring something out, and I want you to tell me that what the smell of it is. Okay. If you can identify it, that tells me that what cranial nerve is acting. So close your eyes. You don't get to see what it is. What our audience does. All right. Ready?
Yep.
Tell me what that is.
I suppose like cinnamon.
Cinnamon it is. Look at it. And you want a cup of that, don't you? All right. Cranial nerve number 1 is intact, which is for smell. And I think that should conclude everything here, Brian. Is there anything that you can think of that maybe we could address today while you're here?
Yeah, I'd say like skin, like hydration and stuff. That
Range of motion?
yes.
Yeah, that would be good.
Yeah.
Okay. Hydration's good. It's falling back. And since you want to do a range of motion test, go right ahead.
Yeah.
Now, the reason why you brought that up, are you getting a little bit of pain?
Not really.
Not really?
Oh,
What
a
a
little bit, I guess.
little bit this morning? You wake
Yeah.
up funny?
Yeah.
Sleeping? Yeah. Oh, maybe that makes sense. Maybe you could get a little massage or something like that. That might help you out.
Yeah.
Where's it? What side is it? That's a little bit
A little bit back here.
right here.
Yeah.
Okay. Well, you could probably do a little massage or something here when I shut the video off and make that feel better. Okay. Anything else that you can think of? No. Nothing you want to address? You think you're fine?
I think I'm alright. Yeah.
Okay. Okay. Well, I think that concludes our assessment for today, and I just want to thank you for your time. If you need anything, get a hold of us.
Okay.
Right.